So brief review of the classification. Already we have done in the first year, classification of the bones and the common landmark or features of the bones. Common means every bone of our body, almost they have all the features, means in everybody. But there are some individual features, means each bone they have their own features, means characteristics and points the other bones don't have. So these are the specific for the specific bone. So we will discuss these 4 points and the upper limb bones. Now look at this. What are the functions of this? Skeletal system consists of several type of tissue, but we are going to discuss they have a cartilage and a bones. What is that? Look at this. What is this one? Cartilage. But this one is bone, very hard. So both are connective tissue, but the cartilage and the bony tissues, rigid type of connective tissue, and the connective tissue semi-rigid, means half solid, half rigid. And the skeleton, the bones provides mainly, we are going to discuss the protection to the soft tissue, like that's brain, vital organs. A skull is giving a protection, and the ribs is giving a protection to the heart and the lungs. Okay, this is the protection. Another mainly we are going to discuss in this system is locomotion, means movement. The skeletal system is providing a movement. Like this one, we are moving our hands and some legs, we are moving. Locomotion is there. And also is storing some minerals and synthesis of blood by the presence of a bone marrow tissue. Where is the bone marrow cavity? Inside the bone, we have a cavity which is containing another type of tissue, not a bone. This is a blood forming tissue, not a part of the bone, means it's not a bony tissue. It is inside the bone, you can say the part, but it's not bony tissue, it's a connective tissue, bone marrow. It's making a blood, as we know. So synthesis of the blood from the bone marrow. Now these are the functions of skeleton. And now come to the second point. Yes, I want to discuss some classification of bones, not in detail, it's only review because we have done in the first year. For example, all of you are here. How can you group? But only these are the boys. You are the boys. You want to make it group. Means you want to classify. On which feature? Okay. I want to classify all of you on the basis of wearing the glasses. You can separate. I want to classify all of you wearing the white coat. Or maybe I want to classify or making a group or subgroups on the basis of or length. Okay. So these are the all the same bones, but on the basis of I am discussing according to the region where are the bones. These are known as a appendicular, means not on the center. This one is known as axis, axial skeleton. Where is the rib? Rib is present in an axial skeleton or in an appendix? Axial. And where is the sternum? And a vertebral column? In the axial skeleton. So how you are classifying these bones? On the basis of region. So now according to the shape now, the same whole skeleton, you can classify according to the shape. A long bone, short bone, irregular bone, a flat bone, very thin. So on the basis of shape, long, short, irregular, flat or sesamoid. We have already done, but we will focus more on structural. What is this developmental? The bones, initially the bones, bony tissue in our body, intrauterine life. They are in the form of cartilage or in the form of membrane. Are you getting my point? And these membrane or cartilage, when they are converted into the bones, this process is known as ossification, means formation of bone from these tissue. What are the tissue? cartilage and membranous tissue. When development is directly from the cartilage, it is known as a cartilaginous bone, developmentally. First, the bones are not in the form of bony tissue. They are in which kind of the tissue? In the beginning? Two, again I am repeating, cartilage and membrane. If directly from the membrane, it is converted into the bony tissue, this is known as a membranous origin. If it is converted from cartilage into the bony tissue, then this ossification means formation of bone is known as cartilaginous. So according to the development. Okay. Skull bones, they have cartilaginous and membranous origin, and a clavicle, both. But the long bones in our body, they are mostly first cartilaginous. Is it clear? Now what do you mean by structural classification?
So could you repeat it?
Structural. Cartilaginous and membranous? Okay. Where is the tissue?
Example.
Like examples? Skull bones. The skull, it has do you know the names of some bones, name of the bones? Frontal bone, occipital bone, parietal bone, temporal bone.
Yes,
okay. So these few bones of the skull, mandible, and these are few of them. I am not going into detail. Few are from cartilage, few are from membrane. Means in the beginning they were in the form of membrane and just in the form of cartilage. When they are converted into the bony tissue, this is known as cartilaginous ossification and then membranous ossification. Is it clear? Okay. Now come to another point. I want to discuss the small features. Okay, structural, what do you mean by structural? There are two types of, on the basis of their arrangement of connective tissue, means their bony tissue. One is known as a very dense. Look at this photograph, you can understand what I am talking. Look at this. Each long bone on the outside is very dense. This is not nice. You have to talk to the technician. His colors are not good. Maybe the problem in mirror, this lens. Look at this. On the outside you can see there is a compact, means solid. But here inside you can see the gaps, pores. This is known as a sponge. What is that called? Spongy shape. And what is this one? So this, if you take the humerus, you will see all a radius or ulna. If you see from the outside, it is covered with the solid material. Solid material. There is no gap between the tissue. There is no gap over here. No space. It's a very solid, this area. So that is known as compact hole. And here is spongy. So every bone on the basis of structure, you can classify spongy or you can say the cancellous. Means spongy means also cancellous. Is it clear now? We have discussed about the classification. Now come to that another point. Long bone, short bone, okay. Yes, this is slightly, you should have an idea about the bones. Do you know the epiphysis and diaphysis? Epiphysis and diaphysis? Just look at this. Every long bone in our body has two ends. This end, maybe the medial or lateral end in a clavicle. Okay, upper end and lower end. Upper end and lower end. Or we can say, what is the other name of upper end and lower end? Proximal and distal. The end which is near to the axial skeleton or origin, start of the limb, is known as a proximal. And this one is known as distal. And what is over here? Again proximal and distal ends. Is it clear? Proximal and distal. Which portion is the proximal? This one or this one? The nails is on the distal side. And this one is starting is a proximal. This part is proximal. Okay. Now we have a two ends. This end is known as epiphysis. And what is this one? In between these two ends, we have a diaphysis. Why we are studying this diaphysis and epiphysis? I will tell you one thing. It's very interesting. Can you recognize if I'm about 40 plus, okay, and my X-ray is in front of you, another X-ray of 16-year boy or 12-year boy is same my size. Height is very long, very, strong man, 16. But I'm showing you the X-ray of that person, of me and that boy. So can you recognize this is the X-ray of Dr. Shahzad and this is the X-ray of that man? How can you recognize? On which basis? Just think about that. Is there any epiphysis? Yes. Due to the cartilage, he is saying. I'm talking about the bone, huh? He is saying separated from, yes. Both of you are right. I will, yes.
Maybe the bone will be more compressed.
Not compressed. Anything else? More dense. Anything else? Okay. Why we are studying epiphysis and diaphysis? Still you have a chance to get the height, but I don't have. Because you have in your bone a cartilage. I don't have. My whole of the bone is ossified now. I don't have a cartilage. Where is this cartilage? Whole of the bone will have, means which kind of tissue? Bony tissue, not cartilaginous tissue. But you in a 16-year-old boy, maybe he have a cartilage, only small plate here, small plate at this level, a plate, only at this level between epiphysis and diaphysis, and over here also. This is known as epiphyseal plate. This is not bony tissue, this is cartilaginous tissue. Why? When this cartilage is present, still the bone can, can get a height. And the length will be there. Because this cartilage will make a bony tissue. Bony tissue. So this will be disappear after 25. At about the 25 age, whole of the centers, means epiphyseal plate or ossification center, means cartilage, will not be present. Before that, means maybe this end will disappear in 16 and this end maybe will be disappear in 25. And like this one, they have a different age, But at about the 25, you cannot find any epiphyseal plate. So what is epiphyseal plate? Is a cartilaginous tissue or cartilage plate. Where it is present? Near to the epiphysis, means end of the bones, between epiphysis and diaphysis. What do you mean by metaphysis here? I have not explained in photographs. Only the ends of the diaphysis here. This is the cartilage, suppose, and you can find near to the cartilage diaphysis, this small portion is known as metaphysis. Is the area between the epiphysis and diaphysis. This is the epiphysis, this is the metaphysis, and this area will be, this is diaphysis. What is this one? Epiphysis. And what is this one? Diaphysis. Metaphysis. And after the metaphysis there will be a plate. What is that called? Epiphyseal plate. What type of the tissues are there? Cartilage. So how can you recognize on the X-ray? The shadow, the image of the cartilage will be black and the image of the bony tissue will be white. So you cannot see the black line in my X-ray, but in 16 boy or maybe younger, you will find there is I will show you inshallah in X-ray, a black line. Already we have discussed in the first year. There is a line that is known as epiphyseal plate. Okay, now come to another we have covered, mashallah, a lot of things. Common features of the all bones. Just focus over here. How many things do you know? I'm giving a 1 minute. Just read all the red color. This condyles, crest, epicondyle, facet, groove, head, tubercle, tuberosity. Do you know the 1, 2, 3? How many things do you know? All the things? 4. Do you know the crest? Do you know the condyle? Do you know the head? Everybody know, huh? Okay. Expanded part, a big part, expanded part of a bone is known as head. I will show you. And a rounded and marks. Okay. What is tubercle? What is tubercle? I will start from here, then I will come over there. What is tubercle? What is, do you know? What is written? A small rounded elevation. Will you give me any tissue or something? You have a tissue? You want to save the pages, huh? Okay. This is the flat area. When you have on the flat area a small elevation. What is this? A small, a rounded, small elevation is known as tubercle. When it is more bigger, it is known as tuberosity. When it is more bigger, condyle. What is that called? Is known as condyle. Okay, again, elevation, projection of small rounded structure from a flat area is known as a tubercle. Is slightly bigger is known as, is more bigger is known as condyle. Is clear now? You have covered 3 things. What is facet? This is very important again. Very long line. Read that. A smooth, a flat area covered by cartilage is not leaving us, huh? Cartilage, where bones articulates with another. So it's better to say not only facet, articular facet. Look at this. What is this joint? What is the name of this joint? So shoulder joint is between scapula and humerus. Whole of the humerus or part of the humerus? So part of the humerus which is making a joint is known as articular facet. Is it clear? So part of the scapula which is making a joint is known as facet. Which facet? Articular facet. So this one is smooth, not a rough. It's a smooth, plain. Okay? And it is covered by a cartilage. Which cartilage? Hyaline cartilage. And why? Inshallah we'll discuss. So these are the features you will find in all the bones. In? What is groove? What is groove? Elongated depression. Majra, huh? Majra? I'm making a majra. Are you agree with this? Are you agree? So what is the name? Don't say now majra. What is this one? What is the other name of this one? Have you taken a lecture? Have you covered the neuro anatomy? Sulcus. The sulcus. In a bone you have also sulcus, grooves. What are that grooves? I will discuss in a humerus. So these are the things are present in all the bones you can find, but some are present in some other bones which are not present in another bones is known as individual features. So common features of the bones we have discussed. Now we are coming our 4th objective, which one is a very long. So just before that I want to discuss how many bones we have in upper limb. Yes.
With the hand, without.
You can count from here. Okay. Just guess yourself. How many do you know? You know the clavicle? You know the scapula? You know the humerus? You know the radius? You know the ulna. But the carpal bones, metacarpal and phalanges, these all bones are present in a hand. So hand has a three parts. A wrist means carpus area. What is that called? Carpus. What is this one? Palm. What are these? Digits. So in a carpal area, in a carpus, we have a carpal bones. How many? There is a one formula. What is that formula? Maybe this is butterfly, huh? Don't think about something wrong. She looks too pretty flying, huh? Try to catch her. She looks too pretty, try to catch her. How many letters I am using? Words, sorry. How many words I am using? How many? I am using 8 words. She looks too pretty, try to catch her. 8 words. 8 words. And take the first letter of each word. Scapula, scaphoid, lunate, triquetral, pisiform, shazad, shazadoid. Why I am saying is shazad and shazadoid? My brother should be like me. Oid means like. If shazad is there, then there should be shazadoid. So what I am saying, trapezium, trapezoid. Which should be the first? Trapezium, and then there is a big bone of all these 8. A head is known as capitate. What is that called? And the last one is a hook shape, hook shape, like a hook, is known as hamate. Look at this, look at this. Because this is the difficult area, otherwise easy. Inshallah, I am sure everybody will sing with me. Come that you are lucky that you have now Atlas here. I will use that and I will explain you, inshallah, with the help of this one. We can make it more bigger. Very good. How can I delete this? Fade, hide. Inshallah, I will come in a sequence, no problem. I am jumping from here to there. So I am sure that you will sing with me, you will speak with me, everything will be clear. So can we label this? Is there any program? Do we have a labels? Which one is the radius?
Bigger one.
The wider one? Huh? How many bones are there? Look at this very small bone. This one is a separate bone. This one. If you see from the front, 1, 2, 3, and this one is a separate. 4 in the proximal row, and here 1, 2, 3, 4. Is it clear? Look at it. 1, 2, 3, 4. Start from here, from lateral, from the thumb. You look at this. This thumb has a power. This thumb can move here and there very easily as compared to the finger. So these fingers cannot move very easily in front of each other. So here thumb can approach everywhere. So Allah has given a almost, not always, almost 2 muscles for each movement. So, and the position of the thumb is, is not like this one, is slightly lateral. The nails are lateral side. We will discuss inshallah in our next lectures. What I am discussing, the carpal bones are 8 in number. I am not going in sequence, I will come in a inshallah sequence. What are their names? Scaphoid, lunate, triquetral, and pisiform. Okay, please come to the slide. Inshallah, we are coming again. Now, how many bones we have in a hand? How many bones we have in a hand? 8. What are their names? She looks to censor this, huh? Pretty, try to catch her. Scaphoid, lunate, inshallah Allah will forget us. Our aim is just to teach you, huh? Okay. Scaphoid, lunate, triquetral. What is this one? Pisiform is a P shape. And what is this one? Shazad, trapezium, trapezoid. And what is this? Capitate. And which one is a bigger bone here in this area? I think this one. So what should be this one? Cap, head. Huh? So what is this one? Capitate. And then hook shape after this one. What is this one? From where you will start? From lateral to medial or from medial to lateral? This is the anatomical position. Where should be the scaphoid? In a proximal or distal row? Proximal. 4 here, 4 here in a carpal. From lateral to medial. What is the first one? Scaphoid. Then triquetral. Very good. I am putting over there. Third one. What is the fourth one? Pisiform. And then trapezium. Trapezoid. Hamate. So these are the actually bones which are present in a carpus, means a part of the hand. And then we have meta, means in front. First we have carpal, then in front of the carpal is meta. What are their names? First, second, third, and fourth. Which should be the first? This one or this one? The lateral one, stronger one. The first, here is the first one. Second, third. If you are writing in your prescription, fourth metacarpal has broken. So this will be or this will be? This one. Fourth one, metacarpal in the palm. And what are the names of the bones over here? How many are there in this thumb? 2. How many in this in this finger? 3. What are their names? Phalanges. Phalanges. Phalanx. What is the name of this one? Proximal. What is this one? Distal. Proximal phalanx. What is this one? Middle. Not medial. Medial is near to the median plane. Middle. What is this one? Distal. And how many here? 2. What are their names? Proximal and distal phalanges. So what are the total here? Not 15, 14. And how many here? 5. Means 19. And how many here? So total are 27. So come to the very beautiful bone. All the long bones. All the long bones. Now come to point, inshallah, in 5 minutes we will cover. All the long bones have ends. What are their ends? Upper end and proximal and distal. And how about the clavicle? It's also long bone. It has a lateral end and medial end. You can see over here it has a lateral end and medial end. Now I am going to discuss about the clavicle, scapula, inshallah. Just focus it. Inshallah you will enjoy. Now how can you say that this one is the medial end and this is the lateral end? If I will give you the clavicle, will you be able to recognize this is the medial end and lateral end? How? Is there any difference? The medial end is like this one and the lateral end is like this one. So what will you say this? This one is rounded and what is this? Flat. Is it clear? How many surfaces it has? 2. Superior, inferior. How many borders means hudud? It has 2. Anterior and posterior. How many? It's not seedha. It has, this bone has curve. One curve and another curve. What are that? Curvatures. How many curvatures? 2. Give me the names of these curvatures. Lateral and medial. A lateral curvature and medial curvature. Which one is the bigger one? One is this one. One is this one. Huh? Which one is the lateral end? Which one is the medial end? This is the medial. And what is this one? Flat is lateral. So which one is the lateral curve? This one. And what is this one? Medial curve. Which one is the bigger? Medial curve. Making a 2/3 of the bone. 2/3 of the bone. It's very important. Normally the fracture is occurring at the lateral 1/3 and medial 2/3. At the junction of the curvatures. It's not seedha. When there is a curvature here, here is the normally fracture of the clavicle is occurring. On the lateral 1/3 and medial 2/3 junction. This is the medial 2/3, 2 parts of the bone and 1 part of the bone. If you make a 3 parts, so 2 parts are going to the medial side. 1 part is going to the lateral curvature. So now the clavicle, these clavicle features are present in humerus? No. So these are known as individual features. These are known as individual features. What are that individual features in a clavicle we have seen? I will repeat: medial end and lateral end, inferior surface and superior surface. And how many borders? 2 borders, anterior and posterior. How many curvatures? 2. And in the inferior surface we have a groove, sulcus. What should be the name of this sulcus? Below the clavicle means lower side, sub means below, subclavian groove. And there is also one tubercle, small elevation here. This one is tubercle. So these are the features which are present in a clavicle. Again I am repeating, in a humerus, now come to the humerus, you will see, not humerus, I am going to the scapula now. You cannot learn properly all the things in a class. When you will go to the lab, when you will see and put the atlas in front of you, then it will be easy. Otherwise it's difficult. Without the lab, gross anatomy you cannot understand. So don't miss that. But inshallah, after 10 minutes you will sing with me, I'm sure. You have now knowledge. I'm going here and there. I will come in a sequence and I'm sure that you will sing with me. Don't sleep for 10 minutes. You are getting knowledge. I know that. You have a lot of knowledge in your mind. But I will bring in a sequence. I'm sure you will be very happy. But I'm saying, now we have done a clavicle. Now come to the scapula. I will make a scapula with the help of, you are not giving a paper, that's no problem. I have a copy, you can take a new one. Dr. Shahzad always making a class dirty, This is the scapula. What is the shape of this scapula?
Triangle.
Very good. Triangle. How many borders? It is like this one. Okay. How many borders? Look at this. Right side. How many borders? This one, and this one. So give the name. Superior. Very good. Lateral. Medial. This is not exam. Whatever you have in your mind, you can speak. No problem. And how many angles? What are their names? Superior. Inferior. MashaAllah, singing. Started to understand. How many surfaces? Two. What are that surfaces? Anterior. Posterior. Good. Excellent. So look at this now. Which end is making a shoulder joint? Lateral angle. Lateral angle. But this lateral angle is not an angle, it's slightly more bigger. What is that called? A new name. I will speak 2-3 times. A glenoid. What is that? Glenoid cavity. What is that? It's like this one. What is that called? Glenoid. Where is the glenoid cavity? Lateral angle. On the lateral angle. And what is the function of this glenoid cavity? Making attachment or joint with and making a shoulder joint. Okay? So this is the glenoid cavity. How many borders we have seen? 3. Superior, lateral and medial. 3 angles, superior, inferior and lateral. How many surfaces? Anterior and posterior. Now another very nice thing. Look at this. What is this one? Which surface? Posterior. What is this one? Anterior surface. I am putting another thing, but it's small. Actually this is a long lecture, otherwise because this is the beginning, that's why I am taking more time. What is again this one? What is this one? Again triangle, but this is small triangle. But I am putting this triangle, please, you cannot understand in the bone, and if you are going to make a concept, it's very easy. This triangle you are putting where? In the scapula or humerus? In the scapula. Which surface? Posterior. What is this is known as a spine of the scapula. What is this one?
Spine.
I will show you. What is this called? Spine of a scapula. And this spine of a scapula, look at this, how it is running. This spine of scapula on the lateral side is going above the, yes, above the glenoid cavity. What is that? Above the, what is this called? This is the difficult word, otherwise everything easy. Inshallah you will be very happy. I'll repeat again. What is this called? Acromion. What is that called? Acromion process. Okay. Acromion. I will show you inshallah. Now you are the master and now everything easy. We have done most of the things. Look at this. What is written over here? Acromion process. Acromion process is a part of spine of, where it is present? Above glenoid cavity. Okay, now look at this. I am speaking about the scapula. In a 30 seconds you can understand. Scapula is a flat bone It is triangular in shape. It is present on the posterior side of the thorax. It has a 3 borders, superior, lateral and medial. It has 3 angles, superior angle, inferior angle and a lateral angle, which is a broad, is known as a glenoid cavity. On the posterior surface you will find there is a spine. What is that called? Spine of the scapula. It's triangular in shape. Again, the lateral end of the spine is known as acromion, which is above. Good, you have done. Now look at this. What do you mean by fossa? Fossa means depression. Anything which is depressed is known as fossa. We have in our hand is a fossa, concave. So in a scapula you have 3 fossa. How many fossa? So what is the the plural of fossa? Not fossas. Put the E. Fosse. Huh? So how many fossa? You will see. Look at this. You have to decide yourself. What is the name of this fossa? Scapular fossa, but this is anterior fossa. I am not giving the name, otherwise you will be confused. Okay, come to the back. What is the name of this one? Spine. One depression is here. Look at this. It's very important for the muscles. What is this one? Supraspinous fossa. What is this one? Infraspinous. Infraspinous. Because this one is below the spine. What is this one? Above the spine. How many fossa? Here we have also curve, depression. But this is subscapular, means below the scapula. If you put the dead body like this one and take the scapula out, where is this fossa? Below or above? Are you getting my point? Where is the scapula? Here. If you take the scapula out, so where is the fossa? Below or above? So what is the name of this fossa? Subscapular fossa. How many fossa we have seen?
3.
What are their names? MashaAllah. Singing. Alhamdulillah. Scapula is a triangular. It has a 3 borders, 3 angles and 1 spine. Lateral end of the spine is known as acromion process, and 3 fossa, subscapular, supraspinous and you know well. This is the scapula. And now lateral angle has a glenoid cavity which is making a joint with humerus. We have done the carpal bone, we have done the metacarpal bone, we have done the phalanges, we have done the clavicle, we have done the epiphysis and diaphysis and humerus, radius and ulna. Should we stop during azan?
Yes,
No, but I was hearing this, if you are giving education or something, but it's better to stop. Otherwise you will not find the La ilaha illallah Muhammadur Rasulullah at the end of our life. But this is not a real recording, huh? And radius, I will show you, they have a heads and humerus has a head. Humerus has a head. Where is that head? Up. And how about the radius and ulna? They have a heads?
yes.
Where is the head of the radius?
Up.
Where is the head of the ulna? Down. Don't say like this 169 again. Okay? Astaghfirullah. Okay. Now here you can see, where is the head of the ulna? Where is the head of the ulna? Which one is the radius? Do you know? This one is the radius, this one is the radius, and this is the head of the radius, and this is the head of ulna. Just put your finger over here. Are you feeling this bone? Not head. Not head. Here. Are you feeling on the lateral side also? Here. Feel it. Feel on the lateral side. Lower end of the radius on the lateral side. I am touching. Please do the practice. Do the practice. This one. Are you feeling?
Yes.
This one is known as a styloid. What is that called? Styloid process. What is that? Which one is the lateral? This one of the radius or ulna? Radius has a styloid process on the lateral side because this is a lateral bone. And we have a styloid process in the ulna also. And near to that styloid process, you will see there is head. And where is the head of the radius? Up. And there is a head, and then there is a neck. So you can see here is the neck, and here is the head, and this is the tuberosity, radial tuberosity, and here is the tuberosity of ulna. What is this one? A notch. What do you mean by notch? What do you mean by notch? Please, notch. Where is the paper? You know, inshallah, you will enjoy it now. This is the time to sing, and you will be very happy. Oh, I know all the things. You will be very proud when I will speak all the things. I will bring all the things in sequence. What is this one? Border. Any depression in the border, not on the surface. Not on the surface. Anything, any depression in the border is known as notch. Is known as? Sometime. Okay. So here we have, look at this. Are you able to see clearly? Here is some process. Notch I will discuss later on. What is this one? Two process. One is coronoid, one is olecranin. One of the patient comes to you, and is falling down on the elbow. And you are looking the X-ray and you are writing, oh, your olecranin, I am speaking slowly, your olecranin process has gone, fractured. Where is the olecranin process? In ulna or radius? Ulna. Radius, ulna, upper part, look at this, olecranin process. Olecranin process. What is this? Olecranin. And there is ulnar notch. I am not going to discuss here. We will see inshallah in the lab. What is this one? Olecranin. Where is the olecranin process? In the ulna. Which one? Is more upper side, or this one is a more upper side? Which one is on higher side? This one. Olecranin process is in ulna, which is also going on the back. Olecranin. And making a joint with humerus is known as elbow joint. So, okay, no problem. Only three things were difficult, and everything you know. I will speak. You know the coracoid process? Where it is that? Coracoid. Difficult words I am speaking. Coracoid in scapula, hook shape. You know the acromion? You know well. Very good. You know the olecranin process? This is in ulna. So these small things are slightly difficult, other things you know. Now I will speak, I will repeat whole of the lecture in 2 minutes, and you will enjoy. And you will be happy, oh, I know all the things. The upper limb has a long bones and a flat bones and a small bones. It has a clavicle which is horizontal in position. This clavicle has two ends, medial and lateral. Lateral end is a flat, medial end is rounded, and it has superior surface and inferior surface. Two curves, medial and lateral. And now come to this is horizontal in position, and come to the scapula is a triangular in shape. This scapula has a 3-3-3. What are the three? 3 fossa, 3 borders, 3 angles, and 3 processes. What are the 3 borders? Superior, lateral, medial. Singing with me, mashallah. 3 angles, superior, inferior, lateral, which is converted into glenoid cavity. And this glenoid cavity is more broad and making a joint with shoulder joint. It has a one triangular, process on the back is known as spine. This spine on the lateral side has acromion, and under this one, above the glenoid cavity, there is a one process is known as coracoid. This is a mixing, coracoid process. And this is we have done. And 3 fossa, supraspinous, infraspinous, and Look at this, mashallah, singing, huh? Humerus has head, medial epicondyle, lateral epicondyle, and tuberosity or tubercle lesser, greater, and between two tubercle groove, intertubercle groove. And radius and ulna both have a head. The ulna head is down and radius head is up. Ulna has, you know, the medial styloid process, and radius has lateral styloid process, and ulna has another thing. What is that called? Olecranon. This is, inshallah, with the speaking, with the, you know, inshallah, practice, it will be in your tongue better than me. And now in a carpal, you know, hand has a three parts: carpus, palm, and digits. The carpus means wrist has a carpal bones. Carpus is a part of the hand, has a bones. What are that? Carpal bone. What are that? 8 bones from lateral to medial, 2 in a row, proximal and distal. In a proximal, you will start from lateral to medial: scaphoid, lunate, tricutal, pisiform, shazad, trapezium, trapezoid. Now, why I am saying shazad? Automatically you are saying a trapezoid. Trapezium, trapezoid, capitate, hamate. Very good. In 1 hour now you are starting to understand. If you are not able to speak, but you are catching my, you know, words, it means you know. And then we have carpal and then metacarpal bone. How many? 5. They are not separate. They are joined in the palm. First is this one or this one? First, second, third, fourth, fifth. And how many phalanges? 14. What are their names? Proximal, distal, middle, or intermediate, you can say. What are these? Proximal phalanx, distal phalanx. Phalanges is a plural. And now, what is the name of this finger, digit? Thumb is there, but we are saying pollex. What is this? What is the name of this one? Index, counting. What is this one? Middle finger. That's why I put the 5 fingers. I saw your smile. What is this? Middle finger. What is this one? It's very difficult to move, you know, to put the ring, huh? This is the ring finger. And what is this? Little finger? But say it, very beautiful name. Minimum means small. Minimi. Digit means finger. Now look at this, I am speaking. Digiti, these names will be helpful for your future. When you will study the muscles are according to that. Flexor digitorum or flexor digiti minimi means any muscle which is going to the digiti minimi. Okay, extensor indicis means the muscle which is going to the index finger. Pollicis longus means muscle is going to this digit or this digit. Okay, again I am speaking. These are the words, no problem. It's very difficult to keep you alive. A very long lecture, but alhamdulillah, I am very happy. All of you are catching 100% from my side. You cannot speak. What is the name of this? Please, for 30 seconds, tolerate me. What is the name of this one? Pollex. Husband of 4 wives, huh? Pollex, moving easily here and there and thus controlling all these. Pollex. What is this one? Index. Delete, huh? Otherwise there may be problem. Pollex is gentle. Pollex. What is this one? Index. Index. What is this one? Middle. What is this one? You are putting a ring. What is this? Minimi. What is this? Digiti. Digit means finger. Digiti. Minimi. Pollex, index, middle, ring, and digiti minimi. We have done, mashallah, and very happy that all of you have done. I have deleted something, but when you will see over there, please don't miss. Bring your lecture, bring your book, and see over there. Make a small. Now you have to decide. Thank you very much. You can go. You have to decide